Do you feel a deep, burning electrical shock shooting down your leg every time you try to stand up? Does the pain in your neck radiate a sharp stabbing sensation all the way down into your fingers, making your arm feel completely dead and heavy? Perhaps your local doctor looked at your MRI, saw a severe herniated disc, and told you that you need major spine surgery. Right now, you are likely terrified. You are imagining a surgeon making a massive incision across your back, cutting through your muscles, exposing your spinal cord, and leaving you in a hospital bed for weeks of agonizing rehabilitation. If you are experiencing this fear, your anxiety is completely justified. For decades, spinal surgery meant massive physical trauma to the body. But modern neurosurgery has evolved. Today, we are going to explore the mechanical reality of endoscopic discectomy. We will explain how we can physically remove the exact piece of disc crushing your nerve, stopping the pain instantly, using an incision that is smaller than a standard coin. To understand why this procedure is a medical breakthrough, you must first understand the mechanical environment of your spine. Your spinal cord and nerve roots are highly sensitive electrical cables. They travel from your brain down through your spinal column and exit through very narrow, rigid tunnels made of bone. Sitting directly in front of these nerves are your spinal discs, which act as highly pressurized hydraulic shock absorbers. When a spinal disc experiences severe wear and tear, the tough outer wall can tear open. The highly pressurized gel from the center of the disc violently pushes outward. We call this a herniated disc. If a piece of this gel breaks off, it enters the narrow bony tunnel and physically pins the electrical nerve cable against the bone. This creates a severe mechanical clamp. The nerve is crushed. Its blood supply is cut off. It begins to send emergency, burning pain signals down your arm or your leg. To stop the pain, we do not need to rebuild your entire spine. We simply need to remove that exact piece of gel that is clamping the electrical cable. This brings us to the devastating reality of traditional open spine surgery, or even standard microdiscectomy. To reach the tiny piece of herniated disc that is crushing your nerve, a traditional surgeon must use a scalpel to make a long vertical incision down your back. Then they must forcibly strip the thick, stabilizing muscles away from your spinal bones using heavy retractors. This process is highly destructive. Stripping the muscle away from the bone cuts off the blood supply to the muscle tissue. It destroys the delicate sensory nerves inside the muscle. When the surgeon is finished and stitches you back up, that heavy back muscle never fully recovers. It turns into rigid, useless scar tissue. This is why thousands of patients who undergo traditional open spine surgery experience failed back surgery syndrome. Their leg pain might be gone, but they are left with a permanent, crippling, heavy ache in their lower back because the surgeon destroyed their stabilizing muscles just to reach the disc. We must cure the nerve without destroying the muscles. We achieve this through elite diagnostics and pinpoint accuracy. Before we ever bring a patient into the operating room, we must map the exact millimeter of the failure. We do not perform exploratory surgery. We demand a high-definition, T2-weighted magnetic resonance imaging scan. When a neurosurgeon reviews your MRI, we are acting as architects. We look at the axial, top-down view of your spine. We identify the exact nerve root that is being crushed, but more importantly, we map the trajectory. We calculate the precise angle required to reach that specific herniated fragment from the outside of your body, bypassing the major back muscles, avoiding the spinal cord, and slipping safely past the bones. We determine if the fragment has migrated downward or if it is hiding tightly beneath the nerve root. We are designing a microscopic tunnel to reach the problem. Once the trajectory is mapped, we proceed with the endoscopic discectomy. This is a state-of-the-art, minimally invasive procedure. Rather than using a scalpel to cut a long line down your back, we make a single, tiny puncture in the skin, typically only 8 millimeters wide. Instead of cutting the muscle, we use a series of smooth, specialized dilating tubes. We gently slide these tubes through the muscle fibers, naturally separating them rather than tearing them. Through this tiny portal, we insert a specialized endoscope. This is an advanced surgical instrument equipped with a high-definition camera and a powerful light source. It transmits a highly magnified, brilliantly illuminated live video feed directly to a monitor in the operating room. The surgeon now has a massive, crystal-clear view of the exact nerve and the exact disc fragment. Using microscopic instruments passed directly through the center of the endoscope, the surgeon carefully grabs the herniated gel and physically pulls it out of the spine. The nerve is instantly freed. The blood flow returns. When we remove the endoscope, the muscle fibers simply slide back into their natural position. There is no muscle destruction. We place a single tiny bandage over the puncture. Because the tissue trauma is so minimal, patients experience dramatically less post-operative pain, and most walk out of the clinic the exact same day. This elegant procedure is not an experiment. It is the result of decades of brilliant medical engineering. In the 1990s and 2000s, pioneers in the United States and South Korea realized that operating blindly or causing massive tissue destruction was unacceptable. They developed these tiny cameras to bring the surgeon's eyes directly inside the spinal canal. Over the last 20 years, this technique has been refined by master surgeons across Germany, Belgium, and the United Kingdom. Today, endoscopic discectomy boasts a success rate of 85 to 95% for relieving severe nerve pain, making traditional open surgery obsolete for the vast majority of herniated discs. If you are living in agony, do not assume that a massive muscle-destroying surgery is your only option. You must protect the structural integrity of your spine. Every spine is unique, and applying a brutal one-size-fits-all open surgery is dangerous. Stop guessing about your surgical options. Let our expert neurosurgeons review your complete medical history and imaging. Click the link in the description to upload your MRI or CT scans to our secure portal. We will map the exact location of your herniated fragment, provide a definitive, personalized second opinion, and determine if you are a candidate for an 8mm endoscopic cure. Take control of your recovery today.